So let's talk about two different types of very commonplace arthritis. One would be arthritis involving the last joint on their finger, called the DIP joints. That's very commonly affected. If someone has pain, if they have instability, if they have inability to do things they like to do during the day, gardening or sewing or any kind of crafts or just hygiene. If they fail this non-operative management, the next step is surgery. And for this particular joint, what we typically do, because you can't do a joint replacement, it's too small, we do a fusion. And the fusion maintains the joint in one position. It doesn't move. But these other two joints do move, so it would move like that. In terms of disability, it's almost minimal. You can use your hand for any and all activities. And in fact, for people who have this condition that need the surgery, it breathes new life into them. They can use their hand for activities. They can grasp things. Their strength is better. They're able to do all the hobbies and crafts and activities that they want to do, and it's really a life-changing event for those people. The second and most common surgery we'll talk about is surgery at the base of the thumb, which on me is right about over here. This impacts a tremendous portion of the population. It is about 5 to 6 times more common in women than men, but after the age of 70, men tend to catch up a little bit. But especially for women in their 40s and 50s, this is a devastating problem. Rest and medication can help a little bit, but ultimately this is a progressive disease. It's arthritis. The joints get worn and the cartilage wears off, and over time, the only way to really fix this is with surgery. Now, fortunately, we have excellent procedures for this. The efficacy, the success rate for surgery is really in excess of 95%. And we do these routinely, several times a week. So the surgery for thumb arthritis is an outpatient surgery. It takes me about 1 hour and 15 minutes. You go home the same day. The recovery is about 6 to 8 weeks, and at that time you have no pain and full motion. One of the other conditions is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease, which means our body actually attacks itself. We're attacking the lining of our joints. The treatment nowadays is really primarily medical. You see a rheumatologist, they give you medications. There is a whole litany of medications you can use, and oftentimes that is successful in terms of staving off the progression. However, there are times where you will fail non-operative management, in which case, if it's rheumatoid arthritis involving this particular joint over here, many times we'll do joint replacement for that. That's another operation that works very, very well. The surgery itself is about 1 hour to 1 hour and 15 minutes. Within about 6 to 8 weeks, people have full motion, everything is healed, and more importantly, they have no pain.